Hi, my name is Christopher Indica Cordia, and today I'll be doing my Anatomy and Physiology 2 presentation on von Willebrand disease. What affects your von Willebrand factor? What is your hemostatic factor for clotting? Von Willebrand disease is a hemostatic disease disorder about your clotting, and let's get into this. The reason I'm doing this is because one of my patients has von Willebrand disease, and we recently had to navigate and go through giving him a carpal tunnel surgery and a cubital tunnel surgery while managing his von Willebrand disease. Thank you. Let's begin. Now, von Willebrand disease affects your von Willebrand factor, or your VWF, which is what I refer to for the rest of this. It is an inherited disease and genetic. It is noticed to be more common in Hispanic and African Americans, as 1/5 of von Willebrand, 1/5 of people treated for von Willebrand in the United States are Hispanic, according to some studies. And African Americans have been noted to have lower von Willebrand factor activity due to certain genes, mainly the D1472H polymorphism genetic gene expression. This is relevant towards any group. It has an age of onset. You can never really tell until you have a trauma or surgery. The life expectancy is normal with treatment. However, it affects up to 1% of it affects 1% of the American population, which is about 3.2 Americans. As a result, its relevance is not that important or not high on the socioeconomic standard, as it doesn't affect a large group of Americans, such as other diseases such as cancer or diabetes. Now, let's do our visual comparison. We'll focus first on the normal populace, which von Willebrand factor helps platelets adhere to vessel laws, stabilize clotting, and impacting blood vessels, liver, and bone marrow, allowing for optimal function of all three organelles. Look, you can see one that has a nice, we tear, let's say we skinned our knee, the tear is there, we clot it with platelets, and then yay, blood flows as usual, allowing for proper nutrition and functioning of the body. Now, if you look at a diseased populace, you notice that they have a deficiency of the von Willebrand factor, which leads to them having easy bruising, nosebleeds, gum bleeding, and not even simple things. It also affects heavy things or more impactful things that you wouldn't think about, such as periods or post-surgical bleeding. Now, I'm going to try and get as close as possible for the post-surgical bleeding because this was the main struggle that we had to deal with. Post-surgical bleeding, this is for minute things. If someone's getting a back surgery, a knee surgery, or if they're getting carpal tunnel surgery, things that happen to a lot of Americans as they grow older, there's so much preparation put into it because of how they could possibly lose their lives over this. Especially if they're going to something with non-local anesthesia, stuff like that. Being allowed to go fully into surgery is something they had to think about, and it's a lot more restrictive and a lot more expensive for them and a lot more risky for them to go into full surgeries. As a result of this, the way we accounted for it was using local anesthesia, and they were on hormonal therapy for 2 years. During those 2 years, to help with their carpal tunnel pain in the interim, we gave them cortisone shots, which weren't as risky as going and doing full open endoscopic carpal tunnel surgery on them. Now, if you look at the physical comparison, there aren't just negatives. There are also there is one positive that scientists have taken looks at during a study. So, your von Willebrand factor, a strong von Willebrand factor has been shown to be unhelpful in regards to staying alive with atherosclerosis. It exacerbates it, actually. While if you don't have a strong von Willebrand factor, your blood can't clot, so you won't choke, and it won't clot up, allowing you to possibly die due to lack of oxygen in your throat. If you look at the next slide, you notice that there's three types of range of disease. You can look at the little pill bottle, because some people at type 1, they only take pills and they do some light preventative stuff. With the abnormal, they have to take more precautions and have more regards in what they can do with surgery. Maybe not taking blood thinners, stuff like that. No baby aspirin. And the type 2 severe, they have almost no von Willebrand factor. You can see the little life support thing. If they get cut and they can lose their lives very easily. It is not easy for them, and it is a challenge, and it is a daily impediment towards their functions in their daily life. Diagnosis can be confirmed with, again, family history. If the family has a history of this, then they know to look for when their kids have accidents when they're young. They attest to your antigens, your ritocosin cofactor activity, your factor V8 activity, and your platelet function to see if your blood clots. Now, treatment and management, there's two types. There's non-curable but manageable, and there's experimental treatments. Now, to be fair, none of these treatments have been confirmed to cure. However, these are more likely to. Now, if we take a look on this side, there's this Deep-Evap. There's Volkswagen, von Willebrand factor replacement, antifibrinosis, and hormonal therapy. My patient used hormonal therapy over 2 years, and it made things very easy for them to go get their carpal tunnel surgery. We did their right carpal, their left carpal, and their left cubital. Experimental treatments, there's gene therapy, there's recombinant von Willebrand factor, and then there's structure function research, where they're researching the functions and the functions of certain genes and certain behavior and how certain genes express, and how, as a result, this leads to certain structures happening, and how they can work around those structures to, as a result, have less impediments and less struggles during surgical operations and daily livelihoods. Social effects and impacts, we can look at how expensive treatments yet limited access. Which ties into number 4 over here, socioeconomic burdens. These experiments are expensive treatments. They are expensive treatments, and as a result of them being so expensive, and the fact that it's only 1% of the population, which is a socioeconomic burden, because why would 99% of the population want to care about 1% of the population? They're not going to donate large amounts of money towards that, nor research towards that, because it doesn't affect a larger group. A lot of research will be put towards things such as cancer or diabetes, things that are highly prevalent and impact the American population. As you notice, there will be tons. If you've noticed over the past couple of years, there's been tons of research, studies, preventatives, access towards chemotherapy. Chemotherapies in pill form, in this form, that. Diabetes, there's so many things. There's Ozempic, there's injections, there's pills. There are so many things based upon preventing and managing type 2 diabetes. But for lesser things, with limited access, a lesser population group, there will be expensive treatments and limited access. There's also the impact of religious and cultural concerns. If someone has Jehovah's Witnesses, they cannot take a blood transfusion. If they get cut and they go to a surgical and they need blood to perform the surgery, which sometimes you will need blood for the surgery because these people are going to bleed. The normal person might need blood for a long surgery. These people that bleed extra and don't clot will need extra blood, and as a result of them not being able to get that due to religious concerns, they're not optimal candidates for surgery. My opinion is that more support and funding needs to be invested into rare disease care, more specifically this one due to my experience with my patient, and the fact that they really made me understand how intricate everyone's healthcare is, and to be grateful for the blessings that I have. Here's my references, and thank you. Have a wonderful day, and thank you for listening to my story. Have a great summer, everyone.